Good evening. I'm Gracelyn Guyol, and welcome to Restoring Health Holistically. This evening's guest is Lisa Mazzaro. Welcome, Lisa.
Thank
I'm
you.
delighted to have you here.
Thank you very much for the invitation.
Lisa is a licensed massage therapist, and she earned her Master's of Science degree in marine biology and a PhD in nutrition prior to that. She worked at Mystic Aquarium for 21 years and then founded her own business, Jazzercise, in 2009. She she received massages once a year, and that's how she decided to make this a career. In 2013, she graduated from Connecticut Center for Massage Therapy as a licensed massage therapist and founded All About You Massage in Gales Ferry. Currently, she is an adjunct professor at Goodwood College, teaching human biology as well as anatomy and physiology. And she is a professor at Three Rivers Community College for Introduction to Nutrition. Thank you. I'm always delighted to have somebody that's a brainy entrepreneur on this show, so I'm thrilled.
Well, thank you.
When we talked about this show, you asked and answered, what is wellness? And so I'd like you to share your perspective on this and explain how massage is involved.
Okay, well, historically, the idea of wellness or good health was the lack of disease. Mm-hmm. So if you weren't ill or sick or in pain, you were considered well or healthy. But that's a pretty historic view of things. And in today's world, things are changing. But think for a moment, think of all of your friends and family and coworkers. Can you think of an example of somebody who isn't really sick or in pain or anything, but they just don't seem healthy to you? Mm-hmm. Yeah, they go around, they're complaining about everything, they seem stressed out, and they're not happy.
They're low on energy.
Right, mm-hmm. Exactly. So in the old definition of wellness, they would be considered well. Mm-hmm. But with the way things are changing, the new definition of wellness, there's higher levels that you can reach. From a mental, emotional, spiritual mm-hmm. levels.
Okay.
So wellness is actually a continuum. If you think of the illness and disease and pain and the treatment of it and the recovery from it as the lowest level on the wellness continuum. Mm-hmm. And massage works very well with all of those at that level. Mm-hmm. As you're recovering from surgery or treating an illness, massage is a great complement to that. And the next level of the continuum is the being proactive, preventative, if you will, okay. Like getting a flu shot.
Okay.
To prevent getting sick, mm-hmm. or going to the gym and working out to prevent weight gain, mm-hmm. or getting massages to prevent getting too stressed.
Okay.
Right? So that's kind of the next level up. And so you can see massage can work at that level as well.
Right.
And then we have the neutral zone. Now the neutral zone is what we would strive for with the old definition of wellness. Basically the lack of disease or illness or pain, mm-hmm. and then you were well. And that's fine, but really there's higher levels of wellness that you can achieve. So wellness is really a tough term to define. There's lots of different definitions out there mm-hmm. of wellness, and I found one that I particularly liked. And it defines wellness as an active process where we become more aware and we make healthier choices that lead to a longer and more successful life.
Well done. That's good.
Now, isn't that what we'd all like?
Well, I think that's the optimum wellness is right. What we're talking about at that level. But we're all in progress going towards it. And it is a process, not an overnight success.
Right,
it
exactly.
Takes effort.
And it's not always how you get the end point, but the mm-hmm. journey to get there, too.
Right, and it's not always a straight linear path.
No, and that brings up a really good point, because you can simultaneously be at multiple levels in this continuum.
Okay.
So
in different areas of your life.
exactly,
Right.
right. So perhaps physically, maybe you've been diagnosed with a disease that isn't going to be curable. That doesn't mean that you can't achieve the higher levels of wellness from an emotional and spiritual level.
Okay.
So this new idea of how how wellness works is to bring the mind, body, and spirit together and match those things.
And a lot of the physical therapies actually engage all three.
Yes, a lot of them do, but not so much in the medical field. If
No,
you go to the medical field, they're
holistic,
going to focus on the physical body and how to treat something or cure something.
That's disconnected from everything else.
Exactly.
And so when you're treating on the holistic, on the body level, you're also inadvertently, in a way, treating on the mental and spiritual level too.
Yes, exactly.
Okay.
And part of the whole process of moving to those higher levels of wellness is to be aware that it's even a possibility. A few years back, I found myself stuck in this neutral zone. I wasn't really sick or ill or in any pain, but I wasn't mentally or emotionally well either. And it showed at work and at home, and friends and family could see that. And I didn't even realize it for a long time. And when I finally came to the realization that there were higher levels and that a change needed to be made, I now find myself at I've achieved a much higher level of wellness.
Well, you're glowing with wellness, so you have achieved it. But I know that it's taken years probably to do so. Well, let's go back to massage, and you mentioned stress being a level, an indicator of not being well in that good zone. So how does massage help with stress?
Well, let's talk about what stress is first.
Okay.
Stress, in my opinion, is one of the biggest factors that affects your wellness. However, stress is not just a negative thing. Most people think of stress as in I'm stressed out, and that sounds like a bad thing. But stress really is anything that takes your body out of homeostasis. And that's just a fancy word that means balance. So anything that takes us out of balance is considered stress, and how our body deals with that stress is what's important. So stress can be, what happens during stress? Let's talk about that first. All of our body systems get ramped up. We activate a part of our nervous system that we call the fight or flight nervous system.
And that's not necessarily consciously activated.
No, it's unconscious. It's just something that happens in our body. And when that happens, our heart rate increases, our breathing increases in rate, but also gets very shallow, and we might start to sweat. But what I just described to you, increased heart rate and breathing and sweating, could also be describing someone who's exercising, which that's the idea here, is that exercise is also a form of stress on the body, but that's good stress.
Right.
Right? Another example.
Because let me just interject,
Sure.
because it keeps the body in shape. Because a
Exactly.
little bit of stress on a regular basis activates all the systems.
Yes.
And so that's good to
Yes.
keep them informed.
Yes, temporary stress
Right.
on the body is a good thing, and it's a normal occurrence.
Right. Okay.
It's just when it is chronic is the
Chronic and
problem.
overwhelming.
Right.
Right.
So you can also think of stress as, let's say you're leaving here tonight and it's dark outside and you're the last one to leave, and you're walking out to the parking lot. Your car is way on the other side and there's no lights, right? And you feel yourself become more aware of your surroundings, and you feel your heart rate increase, and maybe you get this creepy feeling like someone's following you and you want to look over your shoulder. Well, your body is in stress mode. You've activated the fight or flight. Everything is more aware and ready to either turn and fight or run away. Right? But you get to your car, you're safe, you lock yourself in your car, or you stop exercising. it's a temporary thing. And after that, your body goes into the opposite side of the nervous system, the rest and digest side. So we have two opposing sides here, the fight or flight and the rest and digest.
Okay.
Right.
And they don't happen at the same time?
No, they don't happen at the same time. And only during the rest and digest period can your body relax and repair and heal itself. So the problem today is we live in this very fast-paced, overstimulated world, and we spend way too much time in the fight or flight stage.
By our own choosing.
Sometimes by our own
Yes,
choosing.
a lot of the time.
Yes.
It's exhilarating because when we're stressed and doing all of these important things that we must get done in the next 6 hours or something, then it makes us feel important. So we're activating our stress cortisol and all of our stress levels some of the time for ego purposes or inadvertently.
Yes, and you don't even realize it, but it gets to be a daily pattern, and you're always in that high level of stress.
Right.
And what happens when you do that is your body systems are overactive for long periods of time, damage is caused, and you can get chronic illnesses.
And they get depleted because if you're not resting and digesting, then that's how your body gets nourishment and nutrients.
Yes.
To replenish those used up in the
exactly
flight.
And be able to repair as well.
Right.
Yes.
Right.
So that's really the problem, is when you're in this chronic state of stress. So how does massage come into this?
Yes,
right?
please.
So what massage does, so think about it, when you get on, if you've been on a massage table, what's one of the first things that happens? You're in a nice relaxed place, the music is nice, the lights are down, and you go,
yes.
Okay, and then the massage therapist rests their hands on you, and you change from the fight or flight into the rest and digest mode. And your body starts to relax and heal from the inside out.
Okay.
So that's how massage fits in from the standpoint of stress, shifting from fight or flight to rest and digest.
Okay. How does massage work? Once you put the hands on, what happens?
Well, let's start with a definition of massage for people that haven't had one before.
Okay.
Massage is the intentional manipulation of the soft body parts to enhance health and healing. By soft body parts, we mean muscle and tendons and ligaments, skin, and with the purposeful intention of health and healing. Right?
Okay.
So it is a touch therapy, hands-on. And it's thought of as a holistic art. So it affects mind, body, and spirit, which again is very different from the medical field.
Right.
That's focusing on the...
So it is considered a therapy rather than a treatment, a clinical treatment in a way.
Right. You think of it more from the medical side, you think they go in with the intention of curing. And a cure is something applied, a force from the outside, and you're pretty passive. It's like a drug or surgery or a treatment. Whereas where massage as a holistic art actually enhances healing. And healing is a force from inside the body.
The body's built-in ability to heal.
Yes, and you're an active participant in your own healing.
Right.
So that's a big difference there. And it kind of brings together not just the physical side, but it shows you how important the mind and the spirit are in your whole holistic wellness.
Okay. So when you start the massage, what's going on in the body this time?
Okay, so you're applying the massage to the physical body. So let's talk about the physical changes first. They're the easiest for people to relate to and understand. So physically what happens is we start to soften and relax the muscles that we're touching. We can feel we know from studies that have gone on that we cause a temporary decrease in heart rate and blood pressure, which is a great
Good thing for most people.
And actually, I just did a wellness fair last week, and it was funny because a few tables down from me was someone taking blood pressures. And I was giving free 5-minute massages. And they'd get someone that whose blood pressure was elevated, and they'd send them down to me for a massage. And after 5 minutes, I'd kick them back to get their blood pressure done. And so I always talk about this, but I've never actually demonstrated it.
Right.
So after 5 minutes, we actually saw small decreases in blood pressure. So that was pretty amazing,
That was
and
fun.
people were very amazed by that too.
Right.
So we also stimulate what's called a relaxation response, which is bringing us into that rest and digest phase. We're increasing circulation in the body, which is great for bringing fresh oxygen and nutrients to all areas of the body, and that allows us to heal.
Does that help? Does that also enhance detox? Does that trigger detoxification?
Yes, it's going to clean out waste products that our cells naturally produce and help to circulate them to the kidneys for excretion.
Great.
As well.
So a lot of healthy things go on.
Yes, and we stimulate release of natural endorphins in the body, like serotonin.
And we don't have to run to get there.
No, you don't need to get to the runner's high, because I only run if someone's chasing me. That's my rule. But we can release these natural endorphins with massage and give us that feeling of the runner's high, that enhanced state of well-being. Other things that massage can do is to enhance your immune system. It can help stimulate the production of a certain type of cells in the body that help fight infections. And so if you were exposed to a flu or cold virus, your body might be better prepared to fight it by building the immune system. However, I do want to put in a little caution here. Okay, I'm not saying that if you feel like you're getting the flu or you have a cold, don't run to your nearest massage therapist, because they're going to send you home and say, wait 3 or 4 days till you're feeling better, and then come in for a massage. Because it'd be the same thing if you go to get a flu shot and they ask you, are you feeling sick? And if you say yes, they're going to say, well, wait a few days.
Right.
Let's think about it. When we are doing massage, we're increasing circulation. So
you want to spread the illness around.
Right. We want to wait a few days till we're feeling better.
Okay.
So that's the physical side.
Well, one of the other things I just wanted to popped into mind is, I know some elderly people who get massages every week. And the ones that I know have lived to rather old age. One's 101 now. And I know that what you're describing is contributing to that. But I think the other thing is that many people, as they age, are alone.
Yes.
And they don't get touched. And that touch and the massage and the interaction, even with a therapist, is also very beneficial on a spirit level.
It's huge. I mean, just the physical touch to someone, everywhere from massage. This is a good place to tell you that massage is great for all ages, from babies. Even babies have been shown to thrive more with physical touch
when they are touched,
all the way
and
to the
loved.
geriatric population. I actually go into a few long-term care facilities and go around and do just 5-10 minute massages on folks that don't get out of their room much or don't participate. And I feel like, and I've been told by the staff there, that it really has helped them to receive that.
I'm sure
And
it makes a difference.
And I've worked on, in my short massage career, worked on people from age 3 to 106.
Wow.
So,
well, that's a great service.
yeah. So I also wanted to talk a little bit about how massage affects with you from the mental and spiritual side.
Okay.
So mentally, what massage can do is quiet your mind. Now, in this overstimulated world, did you ever lay down at night and you want to go to sleep so badly, but you have millions of thoughts racing through your head?
I call it monkey mind.
Monkey mind, that's a great term. And you can't shut it off.
Right.
Or you get to sleep and it wakes you up in the middle of the night. Well, massage helps to quiet the mind and it brings us into a state of being more aware of our own body, to be more centered and focused and more clear in our thoughts. So it can help sharpen your mind, which
That's good to know.
yeah, I get massages once a week, and that really helps that hour of just resting. I can think more clearly when I get up from that. And from a spiritual standpoint, it brings us a heightened sense of well-being, that feeling of peace and serenity and kind of harmony, not just within ourselves, but with the world as well. So it kind of ties together the mind, body, and spirit. Even though we apply it physically, it affects all parts of our body.
Well, I was really not so aware of the part of it calming the mind, and so that's really good to know. You go get a massage before you have to make any big major decisions.
Yeah, that would be actually not a bad choice to make.
I'd like you to give us some specific examples of various common and maybe not so common ailments. The one is high levels of inflammation. I think inflammation is involved in most of the major diseases. Cancer, diabetes, mental illnesses all likely to have highly inflammatory conditions. So how does massage impact inflammation?
Well, inflammatory conditions, and a few, for example, would be arthritis or even late-stage Lyme disease, which affects the joints. These are painful and debilitating diseases, and a lot of that pain is from the inflammation that people have. Now, just to be really clear, massage will not cure any of these. That's not the intention. But we can help relieve a lot of the symptoms, the pain caused by that inflammation. So if you think about any of those types of diseases where you have inflammation, you have pain, let's just use arthritis in the hands for an example. When someone's in pain, they don't want to move that body part. You want to hold it tight and protect it because it hurts, right? But the less you move it, the more painful it's going to become, because we're not getting oxygen and nutrients into those joints.
Less circulation.
Less circulation. We're not getting rid of the wastes that are building up. And the joints and the tendons and ligaments they don't have good circulation to start with.
Oh.
So they just don't have a great blood supply. That's why it takes so long to heal if you
injure a joint.
Right. So by not moving them, it becomes more painful. And if you were used to using your hands, maybe to play piano or knitting or writing, and you can't use them any longer for those purposes without pain, maybe you start to get more depressed. And as you get more depressed, you want to move less.
You want to stay in bed.
Stay in bed, and the less you move, the more pain there is, and then you get more depressed. And
so it's a vicious circle.
It's a vicious
downward
circle.
spiral.
Yes, and so you really need to find something that's going to help break that cycle. Now, massage, there's been studies done that show that people that get regular massages that have arthritis have had less pain, more movement in their joints, and just feel better overall. So that's already been shown. And I believe, even though there may not be all the research there to support it, that with any of these other inflammatory conditions, actually moving the joints and relaxing the muscles in those areas is definitely going to help. And if you are depressed or anxious or stressed, we've already talked about how massage will take us out of that fight or flight and into the rest and digest. So that, for any of those inflammatory conditions, that can be very helpful.
Well, that makes a lot of sense. I was surprised that massage also helps digestive disorders. I never really thought of that along those lines, like irritable bowel syndrome.
Yeah, well, there's lots of different digestive disorders, and it's hard to lump them all together in terms of the type of massage, because there's so many different types of massage, and some are good for one thing and some are another. But there is
Okay.
a type of massage that I think can be helpful for any of the digestive disorders. But as a massage therapist, one of the first things we do when someone comes in is have them fill out a health history form.
Okay.
And so we need to understand, it's pretty much what you would fill out in the doctor's office. It's very specific,
Okay.
asking for medical conditions so that we know where it's appropriate to work and where it's not.
Okay.
So irritable bowel affects the large intestine. It causes pain and bloating and gas and potentially diarrhea or constipation. But it doesn't physically cause any damage to the large intestine.
Okay.
Right? So because it doesn't cause any damage, we can actually work directly on the abdominal muscles. We can soften those muscles and relax them and stimulate digestion and help to get things moving through there.
Well, irritable bowel is made worse, I understand, when people are stressed.
Yes, it's not caused by stress.
Right.
But stress
But
in
it's
and
made
of
worse.
itself can make it worse or bring about an attack, basically,
Right.
because it's not a constant thing. It's kind of an on
Comes
and
and
off
goes.
thing. Right. But for other digestive disorders, this is where we have to be knowledgeable about these different things or know where to look them up, because we're not claiming to know everything off the top of our heads, or
Oh,
I'm
you
not.
don't?
I'm not anyway. But for something like diverticulitis, where there's actually damage to the intestine, then we don't want to work directly on the abdomen. But the general effects of massage, the relaxation, the increased circulation, and all of that will still be very beneficial.
Good.
So, and
Good.
people that get diagnosed with something like this is, very stressful in and of itself, just to get this type of diagnosis and wonder when is the next attack going to happen, things like that.
Explain how it can help for really challenging ailments like Parkinson's and multiple sclerosis.
Wow. Well, these are both neurological movement disorders, and getting a diagnosis like that can be very devastating.
Emotionally and,
Right.
in addition to the illness, emotionally.
Very much. And again, massage isn't going to cure any of these things, but it can help minimize some of the symptoms that people are feeling, decrease their stress level, their anxiety, which is going to be very
high.
prevalent when you get this. Improve sleep patterns.
Okay.
So by helping to calm the mind and decrease some of the stress and anxiety and bring that relaxation response on, people sometimes sleep better. I get a lot of people that come in for less serious things that that tell me, "Oh, I slept so good after I got my massage." I'm treating someone, or not treating, I'm giving massages to someone now that's undergoing chemotherapy. And just the fact that she can go home after the massage session and actually sleep
Yes.
it has been huge. But so in this case, the nervous system is overstimulated.
With these two disorders.
Right. So we can help to
Calm
relax, to calm things down and bring temporary relief. We can also increase the circulation and reduce the rate of atrophy of the muscles by just moving and working those muscles and keeping the range of motion and keeping the muscles functioning.
Keeping the circulation going.
Right,
Because there is some loss of movement in both of these disorders.
Right, because with both of these disorders, physically, people are going to progressively lose the ability to control function, while their mind is still sharp and functioning.
Right.
So they realize what's going on, and it's happening, and they have no control or a way to stop it. But just by working those muscles and keeping them functioning, even if they can't move them, is going to keep the muscles healthy longer.
So it reduces the rate of deterioration.
It
It
can
can,
reduce
right.
the rate of
Right.
deterioration.
Okay.
No, I'm not making that claim.
Right. But it
There's
that makes sense.
definite benefit to that. And not only to the person that's been diagnosed, but think of their family and friends around them,
Right.
and how, especially their caregivers,
Yes.
how hard this is on them, and how much stress they're going through. So if I were to have the opportunity to work with someone with this type of disease, I would be looking at their caregivers as well, and
Right.
suggesting that maybe they want to be involved with some massage as well.
It sounds like a good idea. So tell us what carpal tunnel syndrome is. I've had friends that had it, and I've had friends that had surgery for it, and the surgery wasn't terribly effective. Now maybe that's unusual. I don't know. It hasn't. I haven't had enough statistical numbers of friends that had this to say. But I wondered, do people get it from texting, and how do you know if it's carpal tunnel or something else, and what's going on here?
Well, carpal tunnel is one of my favorite things to talk about.
Oh, good.
because I actually have worked with quite a few people that come in, they fill out their health history form, and they write, carpal tunnel. And immediately I start asking them a bunch of questions. Well, how do you know you have carpal tunnel? And a lot of them will say, well, my arm and my hand, they're numb and they're tingly and it's painful. And a few of them will say, well, the doctor, I went to see a doctor and they told me. And so I ask more specific questions. Where exactly? Well, my whole arm, my whole hand. I said, well, show me specifically. And what I try to tell them is that carpal tunnel has a very specific pattern of numbness and tingling and pain. And it's only the thumb, the index finger, and one side of the middle finger.
Oh, wow.
That's all that's affected with true carpal tunnel.
That's very specific.
Because the compression is on the nerve right here that feeds this area.
Those 3 digits.
Those 3 digits.
Okay.
Now, if they have pain and tingling throughout their arm or their whole hand, the same thing, the same idea is happening. Somewhere, the supply of blood and nerve impulses past that point, it's just not getting there. And the lack of oxygen and nerve impulses to those areas is causing the pain and the tingling and the numbness. But if it's the whole arm or part of the arm or the whole hand, then it's probably happening further up in the body.
Right.
So it's not surprising that people have surgery for carpal tunnel and it doesn't eliminate the problem, because that's probably, they may have carpal tunnel in conjunction with something else,
Right.
or they may just have something happening up here.
In the shoulder and the spine?
It would be in the shoulder area.
Okay.
A couple of possibilities would be thoracic outlet syndrome or pec minor syndrome, where the muscles in this area are pressing on some nerves and blood supply that are coming down the arm.
So the compression is limiting the circulation and the nerve impulses.
Exactly. But the reason that carpal tunnel gets so much attention is because there's been so much research done on it. Because it's, from an occupational standpoint, this is why employers sometimes, there's all these changes at work, making things more ergonomically correct, because they don't want any lawsuits from people saying that, I got carpal tunnel while I was typing or
at the computer
and
on the
things
keyboards,
like that.
or doing, I imagine even in factories where there's small repetitive movements in building keyboards or digital stuff.
And you asked about texting, right? There's repetitive movements and things going on, and game playing and stuff. But think about it though, while you're texting or typing and stuff, not only are you doing these repetitive movements that potentially could cause carpal tunnel, but look how you're sitting.
Right.
You're sitting in this position.
Hunched over, rounded
forward. We spend so much time in this position. We drive like this. We are on the computer.
I was going to say, the first thing comes to mind is hunched over the computer.
Even sleeping at night, sleep on your side, you're rounded forward.
Yes.
When I do massages, I'm rounded forward. What we need to do is open up this.
Oh, everything popped.
Open up this area. So if they tell me that they have pain and tingling here, I'm going to work further up on the arm in this area. I'm going to work down the arm as well, but I want to open this up first and try to relax these muscles. And I've had quite a bit of success relieving some of the pain and tingling that my clients have had. And if you had the option of choosing surgery or trying something first that might bring you some relief, most people would choose the non-surgical option.
Well,
to try.
I certainly would, and I think
Right.
you're right that almost anybody would rather do anything other than surgery if they don't have to, if given a choice, if they knew they had a choice. So I'm glad that carpal tunnel is one of your favorite.
Right. Well, the other thing with this forward posture, and I have to tell you though, when you walk into my office, if you're a client, or when the client walks into my office, I'm observing your posture, your gait, how you're walking. Are your feet turned in? Are your toes turned out when you walk? How do you sit when you fill out your form? You know, are you slumped over? Are you sitting up straight? As massage therapists, we notice all these things. We sit in the airport sometimes, and just for fun, we watch people walk by and look at the different things. And well, what would I do if that person was on my table? Where would I start? So a lot of people come in complaining of pain in their upper back area, their shoulder area. And that pain is from this, because the muscles in the back are overstretched. So they'll come in and say, my back hurts. And I'll say, okay, lay face up on the table. And they'll say, but my back hurts. Like, well, yes, but we need to work the front of the body first.
Okay.
To open this up before we can get into the muscles back here to
So
work.
you mean you start a back rub with a front opening up of the front?
Sometimes I do. Sometimes I do.
I'll have to remember that, because I have a lot of neck stiffness, and I think it's probably because I spend way too much time at the computer, and I'm not alone.
And I can show them some stretches afterwards that they can do at home to help keep that area open as well, because we spend too much time that way.
We do.
Yeah. You asked earlier, if we can go back for a moment, about inflammation.
Yes.
And I wanted to go back to that for a moment, because anytime we injure ourselves, whether the injury is big or small, it causes inflammation, which brings blood into the area to help it start to heal.
Right.
But when it heals, we form scar tissue.
Oh, yes.
Now, we might not always see externally a scar on the skin, but internally scar tissue forms as well. And when the scar tissue forms, sometimes our muscles and another layer in the body called fascia start to stick together. And when they stick and don't slide easily over each other, it causes pain. Do you know what fascia is?
Yes. Well, I think I do. It's a layer immediately under the skin that all the fluids flow through.
Sort of.
Okay.
Yeah. It's
Tell us what
the best
fascia
way
is.
to describe fascia to somebody is to take a chicken breast.
Okay.
And if you take the skin off the chicken breast, you see that clear membrane underneath. That's fascia.
Okay.
So
it's a membrane.
It's that clear, membranous-looking material,
Okay.
connective tissue that lies over the muscle. So the chicken breast that you eat, that's muscle.
Right. Okay.
And the fascia lies on top. And when you look at the chicken breast, it slides nicely over the muscle. Sometimes in our bodies, things get stuck or twisted up, because that fascia wraps around every muscle in our body, around all of our internal organs, and it's one continuous sheet from the tip of our toes to the top of our head.
Wow.
So have you ever put on a pair of pantyhose quickly in the dark?
Yes.
And maybe they get twisted down by
Yes.
your ankle? But when you start to walk, you feel it in your knee or your thigh or your waist?
Yes.
Okay, so that's what happens with fascia. It can get stuck in one place, but yet you might feel the pain or the discomfort somewhere else.
So what do you do about that?
Well, what do I do about that is when someone comes in and they say they have pain in one certain area, I'm going to work that area, but I'm going to work all the surrounding tissues as well, because it may not be initiated in the
Where the
area
pain
where they're
is.
pointing to. And I'm going to look at how they're standing, their posture, and I'm going to look at their health history form, what kind of jobs they do, what they do during the day, and try to figure out the best place to work on that person. And it's very individualized. It's one of the reasons I named the business All About You Massage, because it's different for every person. And we have to make sure that what your goals are when you come in for a session are that we match our goals. That if you come in for a specific issue, that we try to work on that issue. Or if you come in for just general relaxation, that we're on the same page.
Well, that's, I think today's medicine, holistic medicine in particular, is very clear that every person is absolutely unique. And so there's no cookie cutters that fit all of us, and that that approach has to be the one that a practitioner uses or a therapist uses if you want to get results, which obviously you do very well at, which is why I heard about you. So you have brought a portable table.
Yes.
To help demonstrate for people who've never had a massage what they might expect. So we're going to take a little break while we set up the table and reposition the cameras, and we'll be right back with you shortly. Thank you for coming. We're back now, and Lisa is going to do a demonstration of what to expect when you go for a massage, how it works and what you should wear, and you're going to do how you might treat sciatica first.
Yeah, so first I'm going to just kind of warm the body up a little bit. And one of the common questions that people have is what should they wear when they get a massage? And sometimes people are afraid to ask that, and it's one of the reasons I wanted to address that. Well, you can wear whatever you would like for a massage. However, massage is best applied directly to the skin. Okay?
Okay.
So most of my clients will, if they're comfortable, wear nothing or keep underwear on. But they, if they're nervous, since their first time, it's better if their muscles are relaxed and if they're relaxed on the table. And if this means wearing a pair of gym shorts or a tank top, that's perfectly okay as well. We can work around that and still get to plenty of skin.
Something loose and soft.
Yeah, something that we can get around, and even a bathing suit.
Yeah.
You know,
Okay.
something. But if they're on the table and they're really tense, it's kind of counterproductive for the session, because we want to stimulate that relaxation response and soften and relax these muscles that we're working on. And the other really important thing to know is that when you are on the massage table, your massage therapist is going to be very professional. The only part of the body that's going to be exposed is the part that you're working on at that particular moment. Okay? So nothing else is exposed. If I'm going to work on her leg,
So it's not
That's
full body exposure.
no, never.
Right.
Never. It should always be a comfortable feeling on the table, both in terms of being safe. It's a safe type of touch.
Right.
Okay, so people should feel very safe and comfortable and relaxed on the massage table. Now, normally in my massage place, we'd have the lights dimmed down, which we can't do here.
And you'd
we
have
have some
soft
nice soft
music.
music on, and maybe a little bit of scent in the room to help stimulate that relaxation response. Another common question that I get when people haven't had a massage before is, can I talk during the session? Or do I have to talk during the session?
Right.
And again, this is personal preference. If somebody comes in and they want to talk about their day, that's totally fine. I'm fine with that, and that's their prerogative. That's, again, why I named it All About You massage. But if they get to the point where they're talking about things that are stressing them out, then again, that kind of makes the session a little counterproductive.
Mm-hmm.
So I might suggest that, we might want to work a little bit quieter and see if I can get them to do some breathing to help them relax.
Okay.
So you asked about sciatica.
Yes.
And what I'm doing right now is warming up the muscles around the area where I'm going to work. And there's 2 potential causes of sciatica.
Well, explain where the sciatic nerve runs.
Right. So there's 2 potential causes of sciatica. And the sciatic nerve actually is going to run down the back of the leg. Most people that complain of sciatic pain feel it in the butt or in the glute area, and potential pain, numbness, and tingling down the back of the leg, which sounds a lot like what we were talking about earlier. Mm-hmm. And that's because it is a lot like that. Somewhere, the nerve and blood supply are getting pinched off, coming down the leg. Mm-hmm. There's 2 places where that can be happening. It could be happening up in the spinal area, where there's actually an issue with the nerve coming off of the spinal column and getting pinched between the vertebrae.
Right.
In that case, massage is going to help by relaxing some of the muscles up there, and maybe relieving some of that pain, but it's not going to solve anything. The second place sciatica the cause can be, is in the glutes. There's this little muscle. It runs just like this. It's called the piriformis muscle. And when that muscle gets tight, it presses on the sciatic nerve, which runs down the leg.
Okay.
One of the first things I look for if I have a gentleman come in that's complaining of sciatica is, where do they carry their wallet?
Oh.
If they carry their wallet in their back pocket and they are in the car a lot, sitting on that wallet, it adds pressure into that area. So the idea here is to relax this little muscle and stretch it out and lengthen it. And so in order to do that, we're going to do a little rotation. So I'm pinning the muscle down, and as I do that, I'm stretching and elongating that muscle. And depending on the tolerance level of the client, I might be able to get in there a little bit deeper, ask the client to take a deep breath, and as they exhale,
put more pressure in that area.
Now, once it's stretched, to even take it further, if it's a client I've worked with, I'll ask her to press against my hand and hold that for 6, 5, 4, 3, 2, 1. Relax, take a deep breath, and I can take the stretch a little bit further.
Oh.
And lengthen that muscle. Now, it may bring some relief temporarily, but we have to maintain that in order to keep the sciatica at bay, which could mean regular massages or teaching the client how to stretch that muscle out on their own as
or
well.
moving their wallet
and
to
definitely
another place, or a cell phone.
That's definitely, that's one of the first things we'll say is take that out of your pocket for a month and let me know if you feel any difference. And a lot of times that will help.
Part of the treatment.
Yeah. So as you can see, we've only exposed the leg, and then we will cover that leg back up. And we can actually turn the client all the way over without exposing. So I'm going to ask her to turn over and slide down so your head is on the table. All right. Make sure the client's draped well. We'll give you a nice pillow for your head here. So you're nice and relaxed.
I envy you, you know.
All right, so let's show how we can work on the arm, and the client's draped nice and comfortable and safe on the table here.
Okay, so now this would be treatment for numbness or tingling in an arm or hand?
Right, we talked a lot about that and the potential, it could be carpal tunnel, but a lot of times it happens further up in the arm and shoulder. So again, we want to make sure that we warm all the areas around before we actually work on the main area, which is going to be right up here in the pec.
Yeah.
Now, this can be a sensitive area for people, and a little bit tender.
We probably can't see that side as well. Can you work on this side?
Sure.
From there, or?
Let's cover this side back up from here.
So I'm just thinking how the camera could see where you're working,
Okay.
because we're not able
Okay.
to see what
All
you were
right.
doing from
So we'll
the
try to
other
work
angle.
from this angle a little bit.
Okay. Probably not your usual approach.
No, not quite, but that's okay. All right. So again, we're going to warm up the muscles, the arm and the shoulder.
And I notice you're pushing this little bottle on your hip for lotion.
Oh, yep,
Is
that's
that
the lotion. Now, different therapists use different things. Some use just an oil. I prefer a thicker massage cream. Gives me a little bit more friction, and I can get in a little bit deeper into the areas. So again, the area where I'm suspecting that there's an issue is up here in the
in the
pec,
shoulder?
right in the front of the
the
body
front.
where we're rounded forward.
Right,
Now,
okay.
again, this can be a kind of sensitive area to work. It can be very tender, especially if it's so tight. So one thing I might do is ask my client to participate
Okay.
in the work. And so I'm going to show her the motion that I want, which is sliding the arm slowly up towards the ear.
Okay.
And just like with the sciatica that we were working on, I'm going to pin the muscle in place, and I'm going to have you slide your arm slowly up as we lengthen the muscle down. And can you feel that stretch? Good. And then you're going to bring it down slowly, and we're going to take that stretch up again so that we can lengthen this muscle. We have to retrain the muscles because they've been in this contracted state so long that that's what they're used to.
Okay.
So we have to retrain them to lengthen and soften and not press on the nerve and blood supply there. Now once we've done that a little bit, I might be able to take it a little further and actually get right in under this muscle here. You see, probably not from the best angle. So right in the armpit under this little muscle.
Okay.
And I'm going to slide this muscle down as I straighten the arm up. Okay? How does that feel?
Good.
A little bit looser? All right. When we were talking about arthritis earlier, in the
Yes,
hands especially,
yes. Uh-huh.
we do a lot of work, specific work, on all the little muscles around the joints, the finger, and some nice stretches. Get good blood supply into those areas. And usually the clients with arthritis really, really like how that feels.
And when you're doing this for them, then they learn to do it themselves?
yes,
too?
you can teach them to do it themselves in between coming in to get
because
massages.
increasing that circulation once a day while they're watching TV would be the easiest thing in the world.
Right. Let me take this pillow out. This is usually the client's favorite to have
The neck.
up under the neck
Yes,
work.
yes.
And get some nice range of motion going on in there.
We all carry so much stress in our neck. I'm not sure why, but it just seems to be.
Absolutely. I find that that's the most common place, right up here in the upper traps where people carry of their stress. And again, a lot of that is because we're in that rounded
Hunching
forward
over.
position. And if we can open it up and relax these muscles instead of overstretching them, we start to feel better. So So clients, again, they wonder why, if my pain is in my back, why am I face up? And you're, because I want this to relax and open.
Open up.
Yeah. But you have to explain that to them, because otherwise they're going to think, this massage therapist has no idea what they're talking about. So do you have any other?
I am impressed that massage does a great deal more than what I was aware of. I did not really know that it, I've had massages, but I've always just gone in for relaxation and the experience, more than thinking of it as a therapy that really has value for very specific conditions.
Absolutely. I mean, the general effects of massage are good for any condition, but there's so many specific things that can be worked on as well.
Okay. Well, thank you so much, Lisa. I'm pleased to have you with us. And I wanted to thank your subject here, Lena Hokeiro. Thank you very much for agreeing to this difficult job that you accepted this afternoon. And I want to thank all of you for tuning in to another episode of Restoring Health Holistically. And I hope that you'll join us again next Wednesday night at 7 o'clock. Thank you and good night.